This is the Emergency Medical Minute. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
So I was going to talk a little bit about a case that came in with a unilateral limb pain. As far as sort of the differential diagnosis, the workup, the treatment, and the disposition, that's how we'll sort of organize this medical minute. As far as sort of causes of acute limb pain, things that you organize yourselves around in general are the anatomy of the area. So you think about the arterial blood supply, the venous return, the skin and soft tissue, or any nerve type pain. This patient actually had a presentation that was consistent with acute limb ischemia. So I was going to talk a little bit about that specifically. As far as the presentation, the classic presentation are the 6 Ps. Have you guys ever heard those? So what are some of those just sort of systematically of a... So, poikilothermia, right? So low temperature, and then paralysis is the 6th one, right? So this patient had that presentation. So in terms of the diagnostic considerations, the epidemiology of the cause of that is either embolus or thrombus. Embolus historically was more common, but because of an aging population and more vascular interventions like stents and bypasses, thrombus is becoming more common. When they break it up, it's usually about 30 or 40%, 30% on embolus, 40% on thrombus, and then sort of a combined presentation, which may relate to things like trauma or previous vascular procedures or dissection or popliteal aneurysms. In terms of the workup, what have you seen diagnostically done in the emergency room? In general, the 2 big categories of testing or diagnostic evaluation is the clinical exam, which could include things like pulse Doppler and an ABI test, and identifying the level of pulselessness. Most of these are in the lower extremity, so identifying it, whether or not it's in the femoral, popliteal, or posterior tibial, dorsalis pedis areas. As far as more specific testing, how do we make the decision on which patients need more advanced imaging? Do you guys have a sense? A lot of it has to do with the compartment syndrome is a thought. Mm-hmm.
Pressure test or an ultrasound?
Yeah, so usually that would be sort of an end finding of limb ischemia where the tissue is really at threat. Usually what we're seeing is presentation either for an embolus, which is a sudden onset of pain, generally with no antecedent symptoms, compared to thrombus, which would be usually they have some pre-existing claudication. Have you guys heard that term before? So, exertional pain in the extremity, relieved by rest. And then sort of a subacute presentation because patients generally have some collateralization. If it's an embolus, sometimes all that's needed is the exam, and then we can call the vascular surgeon, and then they can intervene. The next test in terms of our algorithm is ultrasound, arterial neva, and they assess the waveforms, which are called pulse value or PVRs, pulse volume recordings, and then they usually do segmental pressures as well. And then if it's a potential thrombus with underlying, where you really need to define the anatomy, sort of predictably you do a what? You do a CTA. So ultimately, based on those results, they make a decision. Historically, it would be sort of a cut down, and they would use a catheter and pull out an embolus or do a bypass. Increasingly now, based on the presentation, they'll use sort of catheter-directed interventions. So either a embolectomy, or thrombectomy, stent, and then they can always potentially do a bypass at an interval. So hopefully that gives you a little perspective on sort of the clinical presentation of acute limb ischemia in terms of the 6 Ps, the differential diagnostic considerations, which break down into embolus versus thrombus, some of the diagnostic testing that we do in terms of the algorithm, and the treatment that is undertaken thereafter. All right? Any questions?
We are on a quest to provide the world with free medical education. Please help us out by rating us on iTunes, following us on social media, and subscribing to our newsletter at emergencymedicalminute.com.